Learn about more cases of coronavirus in the U.S., our Michelle Griego got some perspective from CBS News chief medical correspondent Dr. John LaPook. He says it's important to be realistic without sliding into panic.
First, we've been seeing things fly off the store shelves here, and it seems like in some cases a lot of panic has set in. We know the advice from doctors and the advice from you is not to panic, but what other advice can you give people who are very worried about coronavirus?
Right. So the best treatment for fear is facts. And I'm not poo-pooing this. This is serious. It's going to spread. There are going to be deaths. It's going to be a bumpy ride. But it's not the end of the world. Dr. Larry Brilliant, who I interviewed last week, who is an epidemiologist who lives around the San Francisco area, and he was the person to see the last case of smallpox in the world, the last case of polio in India, said to me, and he wasn't being flip, he said, this is not the zombie apocalypse, but it's going to be a bumpy ride. And I think he's right. I think we got to be honest with people. It's going to be serious, but it's going to have a beginning, a middle, and end. Things to put it in perspective. The cough, fever, and shortness of breath are the symptoms. So those are the main things, especially shortness of breath. It's thought that once you recover from it, you probably are going to have immunity to it. 80% of the cases in China were mild. So yes, 20% were serious, and they could cause lung disease and even death. One blessing that we're seeing so far is that children are relatively spared. So that's been good. In terms of what people can do about it, the very first thing you can do is if you have not gotten the flu shot, get the flu shot now and protect you and your family. If you're coughing, since we know it's spread by droplets, right? It's a droplet spread. It gets coughed out. If somebody's within 6 feet, it can get in your mouth, your nose, your eyes. So cough into the crook of your arm. Keep your hands below your chin if you can, because obviously if you have your hands with the virus and you put it in your mouth or your nose or your eyes, you can get infected. If you think you don't do that, there's a study showing that in an hour with medical students, 23 times they touch their face. Well, so you try to wash your hands for 20 seconds.
Sure. You mentioned China, and 80% of the cases there were mild symptoms. So let's talk about that, because now there are reports out of Asia, and I want to see what your opinion is on that, that infected individuals who then appeared to recover are getting reinfected.
Yeah, I have seen that, and we have not seen the data. I have not seen the data to really support that right now. I need to know, what are the nasal swabs show? Is there any blood test that confirms that? I've heard that. I think there's a lot of rumors right now. I'm not saying it's not true, but I've looked for that, for the actual data itself, the primary data, and I've not seen that yet. So I think this is a kind of time where there's a lot of reports coming out, and like the initial things of any kind of event, you see some reports that then later on it turns out not to be true. I'm not saying it's going to be false, but I want to see the published report of this, not just sort of a rumor about it.
So a lot of people, they'll go to the doctor with symptoms, and the first question that is asked is, have you traveled out of the country, or do you know anybody who has? And now we're seeing community-based cases. Here in the Bay Area, we see a community-based case. Of course, Washington State has seen them as well, the community spread cases. So what do we do about that, and how widespread do you think this is going to get based on those community spread cases?
I think we have to be honest with people and say it's probably going to become widespread. I mean, it spreads similarly to the common cold or the flu. How widespread is that? This year, there's already more than 30 million people who have the flu, and 18,000 people have died. I'm not saying that's what's going to happen here, but I'm saying that when it's spread by a respiratory route, it tends to spread widely. Think about if you have kids, they come home from school with a cold, how quickly people get infected. So I think people are going to get infected. I think we need more testing kits to know. Right now, I spoke to the CDC this morning. They said we have about the capacity to test 75,000 people by midweek. That's not nearly enough to be able to do widespread community testing to find out, is it out there already in the community in people who have minimal or no symptoms? And then another type of testing is the serological testing of the blood test, looking for antibodies to say, was there evidence of past infection? And then we get our arms around this. Right now, we're kind of flying a little blind in terms of knowing how widespread it is. The absence of proof doesn't mean proof of absence.
Okay, I want to get this question in real quick before you have to go. Vulnerable communities, you mentioned the elderly, people who have underlying health conditions. What about homeless populations? That's something that we deal with here in the Bay Area.
Yeah, and I think often those populations are people who might fall into the category of having underlying conditions or being elderly. So I think that's something that is of concern. I think we have to figure out, as a society, how to do a better job taking care of them. So, this is a big question, and it's going to be a while before we get this under control.
All right, Dr. LaPook, thank you.